Kasente k'abakadde nkamanyi nkafuna bulungi kangasa kubanga bwe nkajjayo nkakozesa ngula sukaali ngula ku nnyama bwento n'amata. Nakwo bwe mba mbadde mulwadde nga nkafunye ng'endako mu ddwaliro awo okumpi.
The government of Uganda has made big strides in improving the well-being of older persons through different policies and programs. The Senior Citizens Grant, SCG, is one of the social protection programs where eligible older persons are provided with a social pension worth 25,000 Ugandan shillings per month. This social assistance grant for empowerment, SEG scheme, is implemented through the Ministry of Gender, Labour and Social Development under the expanding social protection program.
Programu ya SEGOP yajja wano netuganyulwa mu kutuwa ssente. Baatugamba buli group elonde project gye balina okukola. Kati ffe ab'Engogwe ne tulonda Pigare ne tulunda abamu byabalamira. Naye nange saafiirwa nnyo kati wadde zaafa naye naatundako. Nnimako nentema lumonde nentuuka nentunda nennima amayuuni n'obusente abaana be bampa.
To strengthen monitoring and accountability of the Senior Citizens Grant and other social protection services for older persons, Help Age International and its partners, Caritas Gulu and Grandmothers Consortium, with funding from the Federal Ministry for Economic Cooperation and Development, BMZ, through Help Age Deutschland, had established a 4-year project titled Strengthening Governmental and Non-Governmental Monitoring Mechanisms for the Implementation of Uganda's Social Policies.
The project also has got specific objectives. Number one is an effective monitoring mechanism for the implementation of Senior Citizen Grant is put in place. Objective number two, we have complaint, referral and feedback mechanism to be established so that through dialogue, the older people can also improve by themselves access to the services. Number three, a network of older person-focused organization is to be formed.
Through the project, a follow-up, referral and feedback mechanism system led by older persons representatives, also known as National Council of Older Persons, NCOPS, was established.
My role as a councillor in this project is to advocate for the importance of being enrolled.
We also sensitize them so that there are other government programs that they can benefit from. We also sensitize them on the provision of alternative recipients when you are not very fit, because there are some older people who cannot even walk.
They also do what we call psychosocial support. You know, sometimes older people face a lot of problems, which is not even related to government program, like counseling services, maybe talking to the family members on how they can care about the older people. The NCOP also do what we call data collection.
Using this system, data was collected from 5,234 older persons across 2 regions in Uganda, the northern region covering the districts of Amuru, Gulu and Nwoya, and the central region covering Chotera, Luwero and Buikwe. The data collected over the years has provided key findings about the best practices and lessons learned.
Twongedde okuyiga nti ng'abakadde waliwo abayimiriddewo ku buyambi bw'abaana baabwe babaweereza akasente akabayamba, ne wabaawo abayimiriddewo ng'akasente bakajja mu nnimiro zaabwe, era ng'omukadde omwami wabbi eri abakadde abalungi abategeka amasamba gaabwe, naye eri abakadde abayimiriddewo ku bwetaavu nga tebalina nababayamba, abo nabo tubalina ne gavumenti tebamanyi nti gye bali. So kino ekitongole kye kitukoze obulungi, tusobola okwidentifyinga abakadde abo ne tumanya n'ebizibu byabwe.
Abakadde abamu bafunye bakiyambi era nga basobola okubagirayo ki ensimbi zaabwe.
Ngendayo na zino ndaga muntu zange kinyanguyira tebandwisa nakundwisa kuba eri amanyi mu fayiro bajjuzaayo agange n'ekifaananyi ky'oli nga bakirina.
Kakati batugondezaamu luli olugendo lwali wala lwali kugombolola naye kakati batugondezaamu tuzifunira wano kumpi.
Apagatie bien ka man put man put pe kanya achana ke chia ka tiar pur poro ka pur jimna en chek ka mukana charu kanya mukana wilo ki bai koma ento don kumbe de maga man te ka mia kerne chen ma ge mia ne don a ti ki jima konyo ata kilo tena ki pajo ma ate ka ko kumbe de
inde ndo isinaba wesi emyaka yabukadde buno bondaba ndi mukadde.
Akasente kamuyambye mu mbeera engeri gyali omunafu atakyalina kyeyeesobolera kukola. Akasente ako bwe katuukira asangibwa nga buli kimu ebisinga talina okugeza nga ebyokukozesa awaka sabbuuni sukaali biki ebyo kuba byo bigulwa bugulwa.
Katuyambye ne katuwa ebyokulya ebanguliramu akapooli awo baba tebakoze kirundu ebebale.
We also increase the eligibility criteria for the older people. There used to be a number of older people who do not have identity card, and if you don't have identity card, you don't benefit from all this program. So we dialogue with the government department of the community development, and then NERA, National Identification and Registration Authority, to take services closer to the older people. And a number of older people who didn't have identity card were able to be registered.
If this could roll out in all the districts in Uganda, I think the older persons will benefit a lot, and they will know their rights and how to lobby and interact with their local leaders.
Despite progress, challenges persist. Limited resources, inadequate capacity, and lack of coordination hinder effective monitoring.
Kati ebisoomoozo bye tusanze ffe tugenda empty handed. Twagalayo mawulire ffe tulowooza kumuwa engeri gy'anaavaamu ate ye akusuubira nti bw'onooba ojja onojja ne kiro ya sukaali.
We are supposed to analyze data on a quarterly basis, but due to breakdown, sometimes you find a quarter passes when the data is not uploading to the server or the data sheet. That makes it challenging.
At one point, the consortium will exit the district, but as a district, we've integrated programs of older persons in our budgets and work plans. And of course, we are working hand in hand with different departments to see to it that the issues of old persons are given priority.
Obubaka eri Grandmothers Consortium okusookera ddala nsaba Grandmothers Consortium batwebalize baddoona baabwe kubanga baddoona abo bakoze bulungi nnyo. Grandmothers Consortium etuuka ku muntu wa bulijjo, etuuka ku ffe, etukolamu enkiiko, batuwa amagezi. So nekira kyenjagala okubasaba nti ku magezi ge batuwa ne ku nkiiko zino ze tufuna batufunireyo abasomesa abongera ku bya agriculture, ku by'endya y'abakadde kubanga ekimu ku bisinga okukosa abakadde endya yaffe.
Obubaka bwe mubaweereza kusiima.
Tweyansizza nnyo okutulooleza ffe abakadde ayongere nnyo n'abalala batannajja babawandiise.
The partnership has given opportunity to deliver efficient services to the older persons. Yeah, it has also given opportunity for the older persons to know that they can as well influence or make decisions and channel it to the private sectors for them to help in planning, budgeting and programming for them.
We've seen changes in the budgets and flexibility in their programs through the efforts of Grandmothers Consortium.
With her passion and mission-driven partnerships, Grandmothers Consortium and Caritas Gulu remain as ever dedicated to creating a platform for advocacy and lobbying for the rights of older persons by bringing together organizations supporting and advocating for older persons' rights.